Hi there, welcome back. A recent study suggests that endometriosis is associated with increased risk for adverse pregnancy outcomes. And to talk a little bit more about that, we have Dr. Kavoussi here with us, who is a reproductive I can't say it. You're gonna have to say it. I'm so sorry.
Reproductive endocrinologist, like a tongue twister, I know.
It really is. So I asked him how to say it before and it was a little complicated. But can you tell us a little bit more about how this links to pregnancy and everything?
Sure, Madhi. Yeah. So there's this study that came out recently, and it basically has shown that women with endometriosis have a higher risk of having obstetric outcomes that are adverse, like some complications and problems that can be maternal or fetal. I mean, the mother or the baby can have some outcomes that are adverse.
And so what kind of women are at risk to this?
So these are reproductive age women in the study. The women that were in the study when they were enrolled were 25 to 42 in terms of years of age at the time. And these are young reproductive age women, and they have something called endometriosis, which is a condition where the lining of the uterus, the tissue inside the uterus, grows outside of the uterus in the pelvis. So within the body, but outside of the uterine cavity. And it can cause symptoms like pelvic pain and be associated with infertility as well. And then when the women get pregnant who have endometriosis, they can have complications, is what this study showed. And 10% of reproductive age women can have endometriosis.
And so should people get checked, should women get checked before they're trying to get pregnant or while they're trying to get pregnant? You know, how does someone know that they have this?
So that's a great question. So this is a diagnosis that is traditionally been diagnosed by surgery. So the symptoms have to suggest it. So either a woman has very, very debilitating pelvic pain that is affecting the quality of life to the point where they miss work, they miss school, they're hurting all the time, and even their intercourse can be very painful also. So they have many symptoms that are associated with pain that lead the patient and the doctor to think about doing a day surgery called a laparoscopy with small little incisions, day surgery, to visualize and even potentially take tissue that in the pathology department will be a diagnosis of endometriosis. So you can see it and you can actually have it analyzed on a cellular level, but it requires surgery to have a gold standard diagnosis, although some people think that clinical exam potentially can give a diagnosis also without being invasive.
And if someone's diagnosed with this, what would you tell them? How would you tell them to kind of cope with this?
There's so many different ways to try to treat these patients with endometriotic pain. When they have endometriosis pain, there are medical treatments, there are hormones like birth control pills if they're not trying to get pregnant, other kind of stronger medicines if they're not trying to get pregnant at that time, different class of medicines called gonadotropin releasing hormone antagonists or agonists, different meds. So there's a medical way of doing this. There's also a surgical way. So surgically you can treat it too, but usually it's temporizing. Usually, unfortunately, this disease comes back, the symptoms come back. If they're trying to get, it depends on what the goal is, because pain control is one thing and trying to get pregnant is another one too. If it's a patient who's trying to get pregnant, there are fertility treatments to try to help as well.
All right, and I assume that if this is one of the lessons out of this is to listen to your body and make sure that if you feel a pain to go to the doctor and everything. Correct. Is that what you suggest?
That's right. And the study also showed that there's a higher risk, unfortunately, of miscarriage, higher risk of ectopic or tubal pregnancy, diabetes of pregnancy, high blood pressure of pregnancy, early deliveries, low birth weight for the baby that's born. Those are some of the things that we all need to be more aware of and cognizant of, and not to worry the patients and stress them, because not every woman with endometriosis is going to have those complications during pregnancy, but there is a higher risk, and we all need to be a little bit more aware of all those risks so we can take care of these patients appropriately and be very vigilant during their pregnancy as well.
Yeah, right. And where can someone find you if they want to learn more about this?
So I'm a reproductive endocrinologist at Austin Fertility and Reproductive Medicine here in Austin, Texas. And I work out of St. David South Austin Medical Center and Surgicare in South Austin as well when it comes to patient care in hospitals and outpatient surgery centers. But our private practice is Austin Fertility and Reproductive Medicine.
All right. Thank you so much for joining us and for giving us all this information. If you feel like something's hurting, just make sure you check it out. Go to the doctor. Go out and see Dr. Kavoussi.
Thanks a lot, Marty. Yeah.